good advocacy is based on education. And we've got people who are willing to step up and spend all that time and invest all that time in our community. They want good information so that they can lead by facts. And I think that's the core of what the United Way tries to accomplish, is developing good relationships so that these elected officials know to turn to the United Way to try to find the resources to become better educated. And then sometimes it's forming opinions and sharing those opinions, really kind of policy recommendations that can help shape certain issues, because these are really complicated issues that we deal with, and it's not always a right and wrong answer. We're on a journey on addressing many different things, whether it's the way we deliver mental health care in our state, or how we fund those that don't have insurance.
I don't know that people always think about that. I was speaking on behalf of the Urban League a couple of weeks ago, and I took those 4 pillars because I'm losing my mind day by day, and so I thought, how am I going to remember these things? And so I was on a plane, and I looked at the letters, and I used POET for power and own and earn and thrive, because it made sense to me as that that's how I could do it. But in each one of the power, the own, the earn, and the thrive, the underpinnings of that, people have to understand the economic positions of people and their circumstances. And I think sometimes in this business, it's hard for us to articulate the circumstances so that we can get people to buy in to helping other people.
I think that one of the issues that you're speaking to is how do you encourage the heart and link it to actual policy and change.
That's well said.
And so one of the things that we see as very important is that we approach advocacy from really 4 different perspectives. One is we start off with education, and we talked about that, and I think that United Way plays a very important role in education. The next step then is to encourage folks to get involved, again, encourage the heart. Then we take that and we say, okay, what is a plan? And we want to actually get public policy makers to understand the issues and then be able to come forth with a plan to deal with those issues. And then the fourth is actually to get them to pass public policy, but not just to do that, but also to give it some teeth. And normally that means resources dedicated to it.
How hard is it? Or maybe I should turn that question around. How easy is it if we have an issue and we want to make sure that public policy makers are aware of not only the issue, the circumstances, who's affected, but what I think about a lot is the long-term effect of if we don't do the things that we need to do now. What would you say would be some of the best ways that we could get it on the hearts and minds of people so that we could get them a little more excited about it?
We have well, I have kind of a mantra, they won't know it unless we show them. And so one of the things we do within Carolina's healthcare system is that we make sure that our elected officials have been in our care sites so that they can actually see our employees delivering the care and our patients receiving the care, and the struggles that go both ways of delivering appropriate care in an appropriate setting and the struggles that our patients have sometimes reaching that appropriate care in that appropriate setting. So making sure that they have a story or an experience that goes with an issue, I think is critical. And their experience with United Way, many of them have served on your boards and commissions. I think that is an integral part of their education, is to have some kind of experience with a health and human service.
One of the things we've learned is that the more people that touch the organization that they're affiliated with, the closer they become to that organization, they are then more willing to advocate, more willing to give, and more willing to volunteer. I'll bet you get some ahas when you take people on tours.
It's a wonderful moment. It is a wonderful moment when they have assumed they know a great deal, and many of them do, and they see one little piece of the story that I didn't realize they didn't know, or our physicians and nursing staff and allied health professionals had no idea that someone wouldn't understand. And when they see that, you've got them hooked for the duration of their tenure, because they will remember that experience and they will tie it back to a lot of other experiences, and they'll be your best advocates.
Michael, you've got an event coming up, the legislative reception, which I think this is going to be the third one
Yes.
that we have done. Why do you think people ought to come to this event?
Well, it's essential that we pull the community together and provide that shared vision for what the priorities of our community are as it relates to Health and Human Services and the priorities of our United Way. I think so much of advocacy is defining problems and opportunities. And if you can have a shared vision of the defined problem, then you share it. It's no longer someone else's, it's now our community's. It's something we need to address as a group. And I think that event allows us an opportunity to come together, to share information, to commune, and to connect with resources as well. And I think that's the power of that event.
I think it's a great opportunity also, and I'm really glad that we're doing it and it's getting so much public support for it, because I think every opportunity that we can take to connect public officials with the things that we can be helpful to them in their particular areas, I think we continue to learn about how to do that and what things become most important. And to your story, Martha, the ahas, I still think the greatest impact is with stories. When you can break it down to people in units that are small enough for them to remember what in fact you're talking about, then it really does put a face on it. Patrick, I remember something you said a few months ago. We were talking, and you were talking about in your previous life in crisis and assistance ministries and the line that was forming outside of that facility every morning. And you talked about in your new role making sure that people don't get in to the line.
Well, one of the things that we focus on at the Urban League, obviously, is financial stability. And in this community, when you look at disparities, when it comes down to it, economics play a role in just about every one of them. And so in some form or fashion, we have to address that. And one of the things that I have learned, and something that we've been talking about, is really wrapping the data within those stories of the individuals. So as you give stats about places like a crisis assistance ministry, as you look at the population that we serve now at the Urban League, which is the same,
Right.
You really have to be able to get those stories of those individuals out along with the data that's there. So that disparity just doesn't become a number, but it becomes the actual people who are living it every day. Just recently visited Washington for an advocacy trip dealing with one of our programs, which is the Urban Youth Empowerment Program. And it is actually a program that targets adjudicated youth and at-risk youth who have not made it in the school system and don't have high school credentials, need a way to find a job or linkage to higher education. And one of the things that we did is, as we approached our legislators with information about the program, we actually had some students come along with us and discuss their experiences. And I can't tell you how much of an impact they had. They didn't necessarily want to hear from me at that point. They wanted to hear from